Good afternoon, class. Today, we will be learning about the dangers of underage drinking. To give a short overview, teens start drinking as early as your age, about 12 or 13, sometimes even earlier. In this lesson, you guys will learn about why people of younger ages begin to drink and the major consequences it can have on you. Drowsiness, dizziness, headaches, clumsiness, and vomiting are all immediate symptoms of alcohol. Why do kids and teens drink? There are specific factors that cause more frequent drinking in kids and teens. We've either all heard or even experienced issues while growing up. Sometimes certain situations are too much for individuals to cope with, eventually leading to drinking to drive the focus away from those problems. Here are the common factors to underage drinking: low self-esteem or self-worth. During the adolescent years, many teens experience problems with their self-esteem, such as popularity or social status and appearance. Next is curiosity and experimentation. At this age, kids and teenagers often fell to temptation to their curiosity and maybe be wondering what the alcohol tastes like or why others like it so much. Next is peer pressure. Scenarios like this are always common at teenage parties and events. It's basically a desire to fit in and belong to the crowd so you won't feel left out. Even if you don't drink, you might end up drinking because everybody else is. Lastly is self-medication. Basically numbing the pain and letting go of the emotions that you have is a common benefit of drinking alcohol for teens. People have mental, emotional, and psychological dependence on it when it comes to pain. So individuals yearn for the numbing feeling. It makes them forget all their pain. And all those common feelings of depression or sorrow are gone. There are external risk factors when it comes to alcohol use in teens. External risk factors are factors that depend on the teenager's environment. Some examples of external factors would be peer pressure. As I mentioned before, it's wanting to fit in with the crowd and do what others do, which will lead to drinking alcohol. Media advertising. Today, social media and television make a big impact on the younger audience when it comes to influence of alcohol and drugs. Alcohol use is commonly shown in the popular teenage shows, and I'm pretty sure you guys have watched shows where the teenagers have drink. It makes it seem like the alcohol use is fun and it makes you have a good time. Next is parents and family members. One of the more influential factors for alcohol use in teens is seeing their parents and family members drink. They have more access and easier access to alcohol and may not be subjected to discipline when drinking by their parents or family members. Lastly is personality. This refers to the perception of the individual that they are more likable and become the life of the party when they are intoxicated. Some might hear this notion from others and start believing it to get validation from others who may be popular. So they drink because they see that it has a positive effect on their status and popularity. Internal risk factors have something more to do with the individual personally than outside factors. To start off with, genetics is one of them. Anyone with a family history of alcoholism is more likely prone to developing it too. Sometimes genetics may be responsible for almost half of the alcohol addiction. It's basically defined as an individual's genetic makeup and also is referred to as predisposition. Predisposition is a common term used for the role that genetics play in someone's control of alcohol use. It's the tendency or increased likelihood to suffer from a particular condition. In this case, it will be alcohol dependency. Next is behavior patterns. Individuals that experience behavioral issues during their childhood, such as impulsiveness, aggressiveness, and antisocial proneness, are more likely to be subjected to alcohol use when they're in their teens. Certain individuals might have had those behavioral issues that stuck with them until their teens. Next is trauma. Traumatic events such as childhood abuse, sexual abuse, physical abuse, and violence are the most common factors that lead to alcohol consumption amongst trauma-experienced teens. Lastly, stressful times. For teenagers, this is one of the most common. Stress levels often vary between academic, sports, extracurricular activities, and everything else that you have to balance while you're a teen. Sometimes personal and family situations at home can intervene too. Since stress is known to numb pain and emotion, is used as a stress reliever. Here's a practice question for you guys. Is silent drinking problem caused by an internal factor or external factor? What is the common risk associated with alcohol consumption by young people? A. Losing weight. B. Having an accident. C. Going into a coma. D. Getting acne. For answer choice B, having an accident, I'm referring to a vehicular accident. Answer choice B, having an accident, is the right answer. Drunk driving is risky behavior that is common amongst teens and very life endangering. According to the Mothers Against Drug Driving organization, about 1 out of 4 fatal teen car accidents involve underage drinking and driving. Younger drivers are at a higher risk of being involved in alcohol-related car accidents than older drivers. Okay, guys, for this discussion, I want you to take 3 minutes to pair with your pre-assigned partners and answer this question. If the subject may be too sensitive to you, then you don't have to share, of course. Now we're going to talk about long-term and short-term factors of alcohol. Long-term risk factors are the negative effects of alcohol that may affect an individual more severely and for a longer period of time.
Against drinking alcohol,
For instance,
no matter
brain damage.
how much alcohol they're drinking.
When you drink alcohol,
at this age, the brain and body are highly
development, especially since you guys are in your adolescent
way more
years.
crucial.
The brain isn't finished developing until you guys reach your mid-20s.
It can be easily severely damaged by excessive or frequent consumption of alcohol, leading to why individuals under the age of 15 do not have a specified safe limit because of so much
and increased risk of alcoholism, which is defined as continued excessive or compulsive use of alcoholic drinks and binge drinking. Next is increased risk of developing long-term health conditions such as heart problems, cancer, anemia, hypertension, etc. Next are the short-term factors, which cause more temporary effects on an individual. Examples would be slurred speech, drowsiness, clumsiness, vomiting, loss of unconsciousness, and lapses in memory. Although these are short-term, they still aren't effects that will be pleasant. For this short activity, read the directions and take 3 minutes to answer the questions.
Difficulty focus on schoolwork is a long-term effect. Headache is a short-term effect. Brain damage is a long-term effect. Sudden failure on consciousness is a short-term effect. Liver damage is a long-term effect, and vomiting is a short-term effect.
This slide is just short information on impaired judgment and how it can easily be one of the most reckless things when it comes to alcohol use. It's a short-term effect. For teens, this short-term effect often leads to more drinking, physical and sexual violence, and more commonly drunk driving. It also increases the chance of involvement in harmful, unlawful, or irrational risky behavior.
That's going to be all today, class. Now I'm going to pass out the exams.